Is the pandemic over? That's an interesting question. It is showing signs of returning to normal life in many places. In the newsletter, you may have noticed we reported that Coachella and other music festivals are now going back to in-person events, no masks, no social distancing, no crowd limitations. Now the state of California is saying that they are working on moving to an endemic phase. That is different from a pandemic phase, meaning it is something that we expect to live with and not disrupt society in a major way. Interesting that California is the first to use this language when they were the first to issue shelters in place when the pandemic began.
Yeah, and as what you're looking here on the screen is, I think, the big headline here, which is that, COVID cases among 100,000 people plummeting all across the United States. So these cases are now, way, way down all across the United States. So when the hell is this thing going to be over with? And that's the question I have, right? At what point do we say enough's enough, we're done with this? When you have certain states already removing mask mandates, you have other states like California saying...
Wait. Just walk me through the colors again. So the dark color has the highest infection rate and the lightest colors have the lowest. Yes?
Cases,
I can't...
cases are dropping, right?
Oh, okay.
Cases dropping.
Okay. So cases dropping across the board.
Mm-hmm.
Can I just reiterate, though, that from the very beginning, no credible scientist or doctor understands where these numbers all even come from?
Yes. It's hard to... right now, we're only reporting case numbers. Death numbers are also something that's highly charged right now, but we're talking about incidence of new case numbers.
Well, right,
and
but
when
the tests, though, aren't accurate. Like, it's like the numbers have not been... Like, they've been questioning these numbers from the beginning. Like... They've had the real-time data on CNN, like in real-time numbers, kind of like the Iraq war, just making it like, hey, this is what this is, but like nothing backs up that data.
Well, like Chance in our chats is cases are down because they stopped reporting it. Maybe. I don't know, but I know this. I know that estimated 73% now are immune to Omicron. And this AP article asks, is that enough? Is that enough for what, a herd immunity?
Well, it should be, right, because the vaccination goal, when the vaccine was launched, and the initial thinking was that the vaccine will create immunity, which it didn't, but that was the rationale behind it, right?
2
was
weeks
that
to
if we
the
could
curve.
get to, this is a year after 2 weeks to flatten the curve, we had the vaccine rollout. And during the vaccine rollout, they said that if we can get to even 70 to 80%, right, then we'll consider ourselves good to go back to normal life. So that was the big vaccine push, is that we have at least 70 to 80% vaccinated, normal life. So go get vaccinated, right? Mm-hmm. And so if, as that report you just put up, if 80% of the U.S. population has an immunity to Omicron by mid-March, which is what this report says will happen according to the current models, then we're there. We did it, right? Omicron actually did what the vaccine could not, if that is true.
And that's why we're all joking at the beginning, like, oh, maybe now Omicron's here. Everyone should have an Omicron party, kind of like, chicken pox party. Get out there, just get it because it's less severe. But Delta's still out there. In fact, our teacher and our language teacher, she thought she was going to die. She told me, she's like, it was bad. And I'm like, what did you have? Do you think it was Omicron? She said, no, I don't think so because it was so bad.
Yeah.
And so
she's young.
And she's young and thin and,
pretty. Oh, you've
beautiful.
noticed?
No, she's young and she's thin. But she's, she doesn't have comorbidities. She doesn't have any of that. And she's like, yeah, I thought I was going to die the first 3 days. She's like, it was bad. She felt like electricity through my body. It was really painful.
It's awful. I don't think we should do anything to minimize, but we're just talking about the numbers, right? So if the public notice was that if 70 to 80% of people get vaccinated, we go back to normal life, and we did not achieve that through vaccination, we achieved that through natural infection, does it matter? It shouldn't matter, right?
No, look at the Amish community.
Right? So if that's the case, then we should get our lives back.
We should have
but
done from
nobody
the beginning.
should purposely expose themselves to COVID. We just want to make sure we said that.
What did you say, David?
Well, I was just going to say, we've talked about the Amish community. We should have done what they did from the very beginning.
Right. Again, I think everyone should sort of make their own risk analysis and decide what they can do for their own, because it affects people very differently. I'm a healthy person too, and I felt like my pillow hurt when I had it. I was like, I can't even lay here. Everything hurts. Everything hurts. So, but again, now we're talking about, I've even seen on social media, like mother after mother after mother saying, look, mask mandates gone in our elementary school aged kids. That's something we were just celebrating before the show, because we got an email from our school saying that 4th grade and below can now not be required to wear masks. They can still opt in, but it's not. And in fact, one of my friends who went to pick up her daughter for a doctor's appointment said that when they told the 4th grade, all of them, I'm going to cry just saying that, they were all cheering. All these 9-year-olds were like, woohoo, yeah, no more. And I had been worried about my daughter, who is only 3 days from the hospital, from being hospitalized from pneumonia, wearing a mask in school, because you don't want to obstruct airways if someone has just had a lung infection. And I was wondering if I should cause a stink. Should I bring in the note? I was going to ask her pediatrician about it at our follow-up. And there was and now I don't have to, right? So you think about how we as parents have agonized over this. What does it cost them wearing the mask? It's so uncomfortable. When it's hot, it's even worse. And these little heroes have just handled it. We complain about it more than they have. In my experience, in our school, you see these little kids just like, okay, here I go, masking up and going to school. And they don't say boo about it. And it's us that are just in agony over it. And I'm just thrilled for them, really.
So, I mean, as this case points out, as this whole thing points out here, but there's a difference between a declining number of cases and a smaller number of cases. So some regions in the U.S. have achieved both COVID cases have fallen all the way down to levels that experts consider at least relatively safe. New York, New Jersey, Connecticut, all are averaging fewer than 25 new cases per 1,000 per day. So is Washington, D.C. Maryland is doing even just better at 12 cases per day for every 100,000 residents. Most of the U.S., however, isn't quite there yet. In Alaska, for example, new cases are dropping significantly, but the state is still averaging 100 cases per 100,000 people. That's the highest rate in the country. So these in dark brown are the highest rates in the country right now. Still Oklahoma, Alaska is the highest. And these are still the highest. It's interesting that California is moving forward with this endemic phase. What exactly does that mean when they will look at how they are going to move away from a pandemic into an endemic phase? What exactly does that mean for California? And California is saying that we've been, let me see if I can pull it up here. I don't have it in front of me.
Well, it's interesting
notes.
if you look at yesterday, they had a recall election in San Francisco where 3 board members were removed from their elected jobs because parents thought, you have not done enough to mitigate this pandemic on our children. You didn't prioritize getting them back to school. You didn't help them when the science showed that they don't spread it, that the masks don't mitigate their risks. And, you kept kids out of school, and it cost all of us, and especially our children. So when it's costing politicians, even in a small local level, right, then I think politicians are like, uh-oh, it's time. Gavin Newsom won his recall election, but he still was put up for recall based on his handling of the pandemic. So politicians now don't want to keep dragging people along if they cannot use science to justify the rules that are put in place. Yes. I'm done talking now.
Okay.
That's to you.
So what does it mean to be endemic, right, here in California? So let's see. When the virus still exists in a community but becomes manageable as immunity builds, but there will be no definitive turn of the switch, they say. There will be no immediate lifting of the dozens of remaining executive emergency orders. So what exactly the hell are they going to do then?
Well, they'll handle it the same way you handle the flu. Again, it's been so politically charged to say that COVID is like the flu, but now it's exactly how it will be handled. The flu does absolutely kill people.
And they'll look and see if there's a new variant, and they'll make that determination. But right now, they're not. I mean, so indoors, you can take a mask off if you've been vaccinated.
But public health officials will make a calculation on how many acceptable deaths there are. And we all right now are living with a calculable risk of getting the flu and dying from it. And we all go about our days knowing that that's a risk, and that will also be our experience with COVID. We know it's out there. We know that it can be dangerous for certain populations, and we are going to take that risk and go about our day when, in fact, our communities allow us to see this as endemic.
Well, and maybe
there
they'll
are people
also
who make those calculations.
Well, and maybe they'll also, since it's all going to die down, the pharmaceutical companies won't have the stranglehold they do and allow the pre-treatment options that have been available the entire time to actually be used for people, to keep them from getting it and to give them early treatment.
I'm sure they will.
The thing is with a lot of people don't realize with the vax is that they were only able to get an emergency authorization if there was no other drug that could treat it. That's the only way they could do that. So that's why they had to demonize every other drug that could do anything for it. They had to demonize it so that they could keep the emergency authorization.
Yes.
I'm waiting for the other shoe to drop on some of these pharmaceutical companies. We're learning more and more troubling data about the fraud that was foisted upon the American people from the likes of Moderna and others. Faking test results. You have whistleblowers now who are coming out who were actively involved in this and saying, hey, what Moderna was doing with these vaccine results is unconscionable. That's why you have people who are dumping their stocks in Moderna who work there while still working there. They're dumping their stock as they're still releasing new vaccines and other things like that. So something interesting is really about to happen here as it relates to the fraud behind Moderna and Pfizer coming.
Well, and how many months?
Reporting on some of it here.
Yeah, and how many months do we have until the 8 months is up that judge ruled that, the information they wanted to hide till 2055? Like, we get that data in 8 months. It'll probably all be redacted or something, but I think we're about, 5 months away from supposedly getting that data?
Yeah, it's interesting. Yesterday, just today, actually, Pfizer had announced that their Omicron vaccine is delayed due to data gathering. And I find it so interesting to think who would make the calculation to get an Omicron vaccine, right? And I don't want to downplay anybody who would make that calculation, but at the same time, it's just very interesting. And they say that if Omicron mutates, we can still use this data for whatever future variation there is, and so we're at the ready. So that is worth noting.
If you like this content, be sure to subscribe to the channel. Also, we have a membership program. For the price of a cup of coffee once a month, you can support independent journalism just by going to morninginvest.com/join.
You get access to exclusive videos, plus the ability to join and chat with us live. We really appreciate your subscription, and you are supporting independent journalism.